Despite continued criticism from outspoken veterans, a renowned addiction psychiatrist, and others, Congressman Phil Roe says he still supports the way the Department of Veterans Affairs drastically cut opioid prescribing.
And Nate Morabito questioned the chairman of the House Veterans Affairs Committee about the controversial mandate just a week before VA officials are set to share some new research on this topic.
Yeah, that VA research is expected to show a link between the discontinuation of opioids and an increase in veteran suicides in 2 different sample years. You can see an explainer right here, mostly involving patients with mental health or substance use disorders. But today, late this afternoon, we learned from VA headquarters in Washington, researchers have identified what they call methodological issues in the data they're trying to address ahead of next week's conference. That's when VA doctors are scheduled to present their findings at the National Prescription Drug Abuse and Heroin Summit in Atlanta.
I've done aromatherapy, yoga, acupuncture, you name it, I've been there, I've done it.
They're coping with chronic pain, but multiple veterans previously told us Mountain Home did not give them a choice when the VA decided to taper them off of their pain meds.
How is the pain compared to what it used to be?
Cutting opioid prescriptions nearly in half from 2012 to 2017, the result of federal guidelines that warned of safety risks associated with long-term use.
Patients are regularly being deserted, discharged, or coerced into tapering down to subtherapeutic levels of opioids.
The practice remains controversial. This is video from a January 30th meeting of the Food and Drug Administration's Opioid Policy Steering Committee. That's Dr. Richard Lawhern, co-founder of the Alliance for Treatment of Intractable Pain, a critic who says opioid mandates are harming patients.
The VA must be directed to remove and rewrite their practice standard, which mandates the elimination of opioids from practice.
Congressman Phil Roe, a doctor himself, knows the importance of a patient's role in his or her treatment.
Those decisions ought to be made between a physician and the patient. I totally agree with that.
But he also understands more and more people are dying from drug overdoses.
We also know that they've been overprescribed. There's no question about that.
The House Veterans Affairs Committee chairman believes the VA had no choice but to reverse its prescribing practices.
Do you think the VA went about it the right way, though, mandating it?
Well, I think they decided that, hey, they looked at their prescribing practices, which were totally out of line with the private sector. If you looked at how many were getting, when a veteran walked in, how many of them walked out with an opioid prescription, and it was much different than the private sector. So I think they were saying, hey, we need to get in line with what's appropriate, and that's why they did what they did.
So is that a yes?
That's a yes.
Representative Roe says he has not had the chance to see or read the research yet, and as it stands, there's no planned public release date as researchers still try to finalize that data. As for the VA's opioid reduction efforts, the press secretary told us today, quote, VA is recognized as a leader in the pain management field for the responsible use of opioids, end quote.
Nate, thanks. And at one time, Mountain Home VA was one of the highest opioid prescribing Veterans Affairs facilities in the nation. Today, the medical center is now more in line with the national average.